Okay, this is Abby here, Abigail. Abby, do you consent to being filmed for this abdominal exam today?
Yes, I do.
Okay, sounds good. So, Abby, we are going to do an abdominal assessment on your abdomen today. So, could I just have you roll up your shirt for me up to kind of the middle of your ribs there? Excellent. So initially, I'm just inspecting the abdomen. I'm inspecting for the contour, which her abdomen is flat. Also color, I'm assessing for jaundice, which I don't see any jaundice. I'm also inspecting to see if I see any peristalsis in the abdomen, which I do not see any. So next, I'm going to go ahead and auscultate the abdomen using the diaphragm. I'm going to auscultate all four quadrants of the abdomen. What I'm looking to hear is bowel sounds within 5 to 10 seconds of auscultating. That would indicate a normal bowel activity. If it's faster or slower than that, that would be an abnormal finding. So I'll just go ahead and listen. Okay, so bowel sounds were normal, active in all four quadrants of the abdomen. Also, I guess I can break this back out. I'm going to assess the abdominal aorta, and so I can use both the bell and the diaphragm of the stethoscope to assess the abdominal aorta. So I'll start with the bell. Okay, and I'm assessing for any bruits, which I do not hear. I can also use the diaphragm. Next, I will do the renal arteries. No bruits present on the renal arteries. Next, I will do the iliac arteries. Okay, no bruits present in the iliac arteries, and next I will assess the femoral arteries. Normally I would do this on the skin, but for the sake of this video, I will just do it above the pants here. Okay, no bruits present anywhere upon auscultation there. So next I'm going to do percussion. So I'll percuss all four quadrants. Basically, what I am percussing for in the bowel area, I want to hear tympany, which would be a normal finding. If I hear any dullness, that could be a mass, or that could also indicate fluid in the abdomen. So I'm just going to percuss here. So I'm hearing tympany, right lower, right upper, and left upper, left lower, tympany throughout all four quadrants. Also, I can do over the bladder. So percussing over the bladder, if I do hear dullness, that would indicate a full bladder, which right now I heard tympany, which would indicate an empty bladder. So next I will percuss the liver, which is on the right side here. So I'm just going to try to, so once I hear some dullness, then I'll know I've found the liver border. So right there is the bottom of the liver, so I'm going to try to mark it with my ring finger here. And next, I'm going to try to find the upper border of the liver. So I'm going to use my pinky actually. Make sure. Okay, so resonance here, meaning lung, and then some dullness right here, which, oh, here is my little scale so we can see how big. So we got 6 centimeters, which would be a normal finding. So percuss there. Next, I will percuss over here to try to find the spleen. If I did hear any dullness, which I do not, that would be an abnormal finding, meaning there could be some inflammation, which I heard tympany, which is a normal finding. Okay, next, we'll go ahead and do some palpation. So again, I will palpate all 4 quadrants of the abdomen. So I'm going to start with the soft palpation. I'm just looking for any guarding, any pain, grimacing, any pain. Okay. As well, you could possibly feel some masses. Now that I know there wasn't any pain, I can do a deep palpation, which again, I'm assessing for any masses, any pain. If there are masses, I could try to get more of a size of the mass and see the size, the shape of the mass. Okay, so I didn't know any pain or masses upon palpation there. Next, I'm going to palpate the border of the liver here. So I'll have you breathe in, and then it's going to be a little bit of an uncomfortable feeling as I try to touch the edge of the liver here, just kind of underneath your rib cage. So go ahead and breathe in. All right, and you can breathe out. So I was able to touch the border there of the liver. Also, with that palpation, as I am palpating and as she's inspiring, if upon inspiration, if she has to stop the inspiration due to pain, that would be Murphy's sign, meaning that there could be some inflammation of the gallbladder, which would obviously be an abnormal finding, which I did not notice any pain upon inspiration there. Next, I can try to palpate the spleen over here, which again, I wasn't able to find it, but if I did, that would be an abnormal finding, meaning inflammation of the spleen. Okay, so next we can talk about some of the signs. So we did do Murphy sign here, or the lack of Murphy sign was present with the palpation of the liver. The other thing we can check for is for appendix, any soreness or tenderness. So we're going to do some rebound tenderness test here. So I'm just going to do a deep palpation, and as I release, is there any pain there? Okay, and I can do it on both sides. So deep palpation, release, any pain? Okay, if there was, that would be rebound tenderness, indicative of potential appendicitis. Okay, and then another thing we could do is to test for ascites in the stomach. So if there was some ascites, I could check the tympany in the top of the abdomen. So there would be tympany throughout, and then there would be dullness here on the sides because of the fluid kind of around the abdomen and the air towards the top of the abdomen. Then I would have the patient turn to the side. I guess in this case I would have Abby turn towards me, and the air would shift to the top of the abdomen, and the fluid would go towards the bottom, so there would be dullness towards the bottom and tympany towards the top of the abdomen. Okay, lastly, I will have you sit up, and I guess this will kind of be a little awkward in the bed, but I'm going to have you kind of turn towards that way, and I'm just going to check, for any CVA pain here. or flank pain. So let me know if there's any pain. Any pain? Okay. Any pain? Okay. So if there were flank pain or CVA pain, that would be indicative of a potential kidney infection or kidney stones, which none was present there. All right. Well, thank you so much, Abby. That concludes the abdominal assessment.